listeners, welcome to the latest episode of Voices in Leadership, a Leading Age Virginia podcast. I'm Melissa Andrews, President and CEO, and I am super excited because I was just sharing with our guests that they have been on the list since we launched the podcast. I don't know, we're in season 2, so I don't know when we launched, but to be interviewed. So I'm really happy that both Winoka Clements and Brandy Day are joining me today. When we think about the rock stars in talent and aging services, you two are certainly the people that stand out in our membership. So thank you for being with me today. And as always, I'm going to ask you to introduce you because you know you best. And Brandy, I'm going to start with you. If you just tell our listeners anything you want to share about yourself.
Sure, absolutely. Hi, I'm Brandy Day. I'm the Chief Talent Officer at Williamsburg Landing, and I've been here, it'll be 10 years in April. And senior living was new to me when I came into this role. I had a background in HR support and consulting, K-12 education, and local municipality. And that local municipality was my prior employer before coming to Williamsburg Landing. So I was looking for something that was more impactful, where I could make a difference in people's lives. It wasn't a community that I lived in, so that wasn't a pull for me, nor is it easy to get excited about stormwater. So I was looking for something that would be meaningful to me, and Williamsburg Landing became that place. Like I said, I've been here for 10 years. I started in human resources about a little over 20 years ago as a recruiter, and then more into generalist and consulting roles, and then a supervisory and director role. So that's kind of the progression of my career. I have a BA from George Mason and a master's degree from William and Mary, and I really love what I do.
Thanks, Brandy. How about you, Winoka?
So hello, my name's Winoka Clements, and I've been at Vinson Hall Retirement Community. It'll be 5 years in July. I've been in HR probably around 15, 16 years. And the majority of that time has been in aging services. I actually started on the home health side, which is kind of my first taste of healthcare, if you will. I wasn't really driven to aging services, stumbled into aging services, and just really have found a place that, as I like to say, fills my cup. Absolutely with the connection with the residents on a regular basis, but really supporting the people that care for older people is important to me. I started off in HR more on the franchise restaurant side, and then again moved on the home health, home care side of HR. Some of the things that are just amazing, really, where I'm at Vinson Hall is the community that we're at and the support that we give to our staff and the things that we've done. And I can't wait to share some of those things as we get into the interview. But you did say I could share, my long walks on the beach, and, my favorite color is orange, and I really miss Prince, Roger Nelson. Yeah. So,
I'm with you.
So that's a little bit, I guess, about me.
Excellent. So let me ask you both, what drew you into HR? Winoka, let's start with you. And what were you doing before? Were you doing something before HR? Did you have a career before that?
I did. That was when I was raising kids. And so I was doing retail. I was in a little small town in Arkansas. Not a lot of options there. Fort Smith, Arkansas. Was working retail and had moved up into management of retail and just didn't want to do it forever. And then moved into a customer service role supporting healthcare companies. So kind of maybe my first taste of healthcare, if you will. So and from there and just moved and, from an HR assistant to manager and made my way as the senior director of HR here at Vinson Hall. Have had the opportunity to move in several other communities, other CCRCs and life plan communities. And so HR has been, that comfort place for me. I did step out onto the operations side for a few years as a licensed nursing home administrator, supporting the actual residents, and realized that's not my lane. There are amazing people in that lane, but that's not for me. So came back to HR.
Yeah, I once had some wonderful female leaders. I met with them about going into the operations side, and about doing my AIT and found out later that behind my back, they were like, that's not the path for her.
Yeah.
Not going to be for her. And yeah, I was like, thanks. It's very important to know what you don't want to do while you're
Yeah.
trying to find what you do want to do. How does McLean, Virginia compare to small town Arkansas?
Very much different. Very, very, the demographics are different. In Northern Virginia, just generally speaking, more diverse. So I do value that. I do appreciate that. A few years back, I had been contacted by a headhunter and said, hey, we've got this great opportunity down in Tennessee. Are you interested? And I went to look at the demographics. No, I just can't, because it doesn't have the same diversity as we have here in the Northern Virginia area. I told him, I said, I'm going all the way back to Fort Smith, Arkansas. Where will I get authentic food from down there in Tennessee?
Authentic
no shame to Tennessee,
right.
Of course, but
right. Yeah, no, we're not trying to, yeah.
Yep.
Tennesseans, we love you.
Yes.
Love you. We're going to Nashville in the fall.
Yes.
It'd be great. It's gonna be great. Brandy, what drew you to HR?
So I kind of fell into HR too. I had graduated from George Mason with my bachelor's degree and was working with a headhunter. Went to interview with them, and during that interview, they stepped aside and went and talked with one of their colleagues and said, "Man, I think she'd be really good as a recruiter." And so they hired me as a recruiter, and that was my first venture into HR. Pretty specific into HR as far as the just doing the recruitment aspect. When we relocated from Northern Virginia to the Hampton Roads area, I got a job in healthcare as an HR assistant, so really broadened my HR experience into more of a generalist role. While I was there at Riverside Regional Medical Center, Newport News, we had an HR audit done, and consultants came in and interviewed us, and they actually ended up hiring me as one of their HR consultants. From there, when you're working in consulting, it's difficult to see a project through all the way through and know how it impacted an organization, because it's one engagement, you're done, you're moved on to the next engagement. And so I really wanted to see, like, how did that placement that I made really work out for them? Are the exit interviews that I'm conducting for the city of Richmond making a difference for the employees in the city of Richmond? So things like that. I was looking for something that I could be a part of an organization in human resources. So I applied to Williamsburg, James City County Public Schools. My parents are both retired teachers, and was there for 8 years and needed to kind of move forward in my career. The director was there, and no intentions of retiring. So then that's when I went to the local municipality and became the director. And that's what got me here as the chief talent officer.
So, listen, the number one thing that keeps our members up at night is workforce, right? Like, that's what we've been saying for, people say we've been saying it for the past 4 years. No, we've been saying this for a decade, right? Like, we've known the demographics. What's the number one thing that keeps you up at night?
Brandy?
Retention. For me, it's retention. I don't necessarily think that we have a recruitment problem at Williamsburg Landing. I think we need to focus more on retention. So hiring the right people, but more importantly, keeping them for consistency and care for our residents, for camaraderie among the staff. So when there's a revolving door, it's hard to get to know your peers. It's hard to ensure that the residents are being cared for on a consistent basis. And so the focus for us is really on, how do we retain these folks? How do we get their feedback? How do we engage with them? How do we recognize them? So all of those pieces are really critically important. It's not, the hiring aspect is really important too, but if you have the skill set, you can do the job, but it's really, are you a fit for our organization, and hiring the right person, but then you have to keep them.
And I want to circle back to all the work you've done on retention, Brandy, after Winoka shares what's keeping her up at night.
And on the other side of that is the recruitment. I know we've been looking at this for years, and yes, the pandemic changed our lens of recruiting, but I know we all feel that now I'm no longer competing with like communities beside me or down the road. I'm now competing with other industries. Mm-hmm. And how do we change the way we do things so that we're flexible with people's life work balances, that we can change. We're so set in our old ways, nursing schedules are 7 to 3, 3 to 11, 11 to 7. How do we change that so that we can bring in different kinds of people? And then to that point is, how do we tap into other markets? I just did a virtual job fair that was geared towards 50 and older candidates. And I was just thrilled, right? Because that's an untapped market that we've not been intentional with recruiting or approaching or talking to. And I'm glad I got three resumes after that virtual job fair. But that's just one of the groups, one of the demographics that we need to be better at tapping into. So I would just say the recruiting side of staffing.
It's funny. So I'll share with everybody that Winoka's on our board. She just joined, which I'm just absolutely thrilled about. But, Winoka, when I first came to Leading Age Virginia, I came in 2016 and went to the board and said, I think we need to do a statewide study to really understand not just what our members are saying they want and need, what are the challenges and opportunities, but what Virginians are saying. And so we did a quantitative and a qualitative study. We partnered with a group out of Richmond called SIR. And one of the outcomes was untapped workforce demographics. And it was second career. So veterans and law enforcement, as well as, and then 50 plus, like that really fall in that demographic. You can really look at, like, my dad retired from the DC Police Department when he was 41 years old. So, and so we had all of it. That was like a 2-year project. And we had all of it. We were getting ready to say, what do we do with it? And then, of course, it kind of put on the shelf. And I just wrote a note to myself 2 weeks ago to say, I think it's time to dust that off and think about what's our strategy around supporting our members and thinking about statewide, how do we tap into that? So to be continued. It sounds like we need to have that conversation, maybe at an upcoming board meeting. So I appreciate that. But Brandy, circling back, you were in the first Leading Age DC, Maryland, and Virginia Leadership Academy. And your action learning project was really all about culture and retention, if I recall correctly. There was something about a red carpet.
Yep.
And
yes.
Football team and flowers and getting into the person as the person. So tell us about what you've worked really, really hard on at Williamsburg Landing around retention, and share the data if you want.
Sure. So we used to have an orientation here that was kind of a sit and get, and, checking the boxes on the regulatory components. And I felt like there was a different way to do that so that we could engage with our new employees from the get-go so that they could build relationships with residents. So my action learning project was really to revamp our orientation. And so we did focus it more on the individual and the person. We include a personal preference profile document as part of our new hire documents that we email out to all of our new hires. And it just asks questions like, what's your favorite sports team? What's your favorite flower? Where do you like to get dinner? What are your favorite snacks? So we know what they're into. And we actually incorporated that into our orientation, because at the part of our orientation where they are taking a tour, it's right before that, we have a resident panel. So we have 6 or 7 residents that come in and talk about what it's like to be a resident here and engage with our staff and what do the staff mean to them. And then when they get back from their wellness tour that's strictly focused on their wellness benefits for them, they have a card in front of them, a welcome card signed by one of the residents who they just met on the panel, and something off that personal preference profile. So it really connects them not only with the resident, but it tells them we're listening. We want to know you and who you are as a person. Also from the Leadership Academy, I thought to myself, wow, we could do a Leadership Academy at Williamsburg Landing. And so we did that. We built a Leadership Academy with the help of a consultant from Cobalt Consulting named Mike Travis. And he was just instrumental in partnering with me to really understand what the needs of our employees are. And there's been different iterations of that Leadership Academy based upon where we are as an organization, but also the composition of the cohort that's going through it. We've incorporated DEI into our Leadership Academy. And actually, those Leadership Academies won the Workforce Excellence Award through Leading Age Virginia in 22. So lots of good stuff.
Winoka, you were excited to share some things you had going on. Do you have things specific to retention that you want to share, or do you want to go into a different territory?
So, yeah, it's in trying to keep people, as Brandy said, we're doing a lot of things specifically with DEI. We're at the point now where it's not this standalone leg on the stool, if you will. It's just incorporated in all that we do. And so there's not these flashing lights, hey, DEI moment, DEIB moment. It's just interwoven in that. And so I will share one thing on the recruiting side versus the retention side. We have done some work on being inclusive for neurodivergent people.
Mm-hmm.
We're
Okay.
looking at, our interview guides, the way that we prepare someone for an interview.
Mm-hmm.
Some of us do great at panel interviews. Some of us need to prepare for panel interviews. Some of us are more one-on-one. So we've done, as an HR team, a lot of work in making sure we set this candidate up for the best interview possible. And then part of that is training the leaders, right, to not make some assumptions. Well, they didn't answer this question, so maybe they're not the best fit, versus maybe they were nervous, versus, maybe they're not an extrovert versus an introvert. So we've done a lot of work just expanding what inclusion means, not just race and gender and age, but also neurodivergent differences amongst us.
Winoka, that's so, again, it's like so serendipitous. So there's an organization called Commonwealth Autism, and they bought a grocery store locally, Good Foods Grocery here in Richmond, and they bought the building behind it as well. So they're piloting their first cohort of high functioning, low service need people living with autism that are doing classroom learning, and then they're working in the grocery store. And they're going through this, soft skill, hard skill training, and I'm going to be working with them to position our members here in Richmond as potential employers for this cohort. They're hoping to take this statewide. And actually our team, as part of our DEI initiative, is going through Autism and Neurodivergence 101 training in March through Commonwealth Autism, because again, it's like we have to look at through all lenses of DEI and really thinking about that. So you and I should talk more about what you're doing. And Commonwealth Autism has been a great, partner for us right out of the gate, and thinking about how to best support those team members once they come on site, because there is a different level of support. I'm wondering, have you all talked about that different level of support, kind of thinking that through? Are there, just what are you talking about internally?
Yeah, so what we realized, we're just early in this kind of process, if you will. There's, and Brandy, I'm sure will agree, that there is a level of support that HR can do, but that's really short-lived, if you will. It's kind of at the beginning of the relationship. And then how do we prepare the managers to support the folks? So that's really where we are, is what do our leadership team need to support people that are different in this way?
Yeah,
absolutely. You can come to HR and we're prepared, we're trained, we can help you, but it's building up the strength of the leadership team that we're focusing on.
Absolutely.
Yeah, that's the conversation we've had with Commonwealth Autism. And they were saying that in the past, where they have fallen down is that they've helped their participants get placed, and then they've let go. And now they're going to stay with these fellows, for lack of a better word. They've gone through their training for a year. And so they can continue to support them. And so we've talked about, what kind of training support do we need on the employer side? So I think there's a lot of potential and non-clinical, right? I mean, there's like, we talk and that's another question for you both, because we spend so much time talking about our needs on the clinical side. You talk about the non-clinical parts of the organizations and just, what you're feeling, what you're seeing. And then my follow-up question, and either of you can jump in, is the role of HR versus the role of everybody in terms of culture, in terms of retention, just in terms of it all. So kind of two different questions.
I like the second question. Brandy, you want to go first?
Whichever question you want to answer.
Okay.
So, yeah, I think HR, we call it talent management here at Williamsburg Landing, but HR really kind of sets the tone for the culture of the organization with the senior leadership team. I mean, it's got to start at the top. Those ideas have to percolate and grab a hold of the senior leadership team. And then that has to permeate the organization. It's not something that HR is not the only one that owns recruitment and retention. It just can't happen that way. My department's myself and 3 others, and there's 4 people are not going to be able to carry this organization. And so they've got to understand the entire organization, including, your line staff, have to understand that they play a part in recruitment and retention. We have an amazing referral bonus program, up to $1,000 after 6 months. And we've been able to hire a ton of high school students for our dining room server roles. And also across the organization, that referral bonus has really helped us. So they understand that they play a role in the recruitment, but the other side of that is certainly the retention and welcoming them. That can't be the red carpet. A literal red carpet can't be rolled out just an orientation. It's got to be continuous, that they feel like they belong. And that's part of our DEI efforts. We actually have a DEIB advisory council, and the B is belonging. And to me, that's the most important piece of DEI is that people feel like they belong. They can bring themselves to work as authentically as they are, and we honor that. And others see and recognize that differences should be celebrated, and that it leads to a lot of creativity.
Yeah, and I would add to that. I went to a conference, I think last year, and the discussion was about how long is the relationship for an employee that you hire or a candidate. Is it as long as they work for you and then they leave and then the relationship ends, or does it extend past that? And it gave me a different view of, you may only stay with us for a year or 2 years, but let me stay connected with you in some kind of way, because things may change. You may go out and, get a degree, or you may get this experience, and then perhaps you'll want to come back. And so from an HR perspective, I've had to extend what the relationship, like how long is this relationship? It's not just when you are, my employee. And so I haven't figured out yet how to do that. Is it a birthday card? Is it a, hey, how are things going? What is that touch point after you leave Vinson Hall, leave our community? And to Brandy's point, and I know we all agree that yes, DEIB is not just HR. Right. When I've been in so many situations where I'm the one standing up and saying, hey, we need to be diverse and inclusive. And my peers around me at other communities are just like, yep, that's what she said. What she said. We agree.
Yeah.
And we had a situation here where it kind of was that setting where I was the face of DEI. And what surprised me is that my peers responded with, I didn't know what to say.
Mm-hmm.
When a resident said, oh, they're trying to change the way we talk, because we were talking about inclusive language. Oh, they're trying to tell us we can't use him and her. We have to use it, right? And my peer said, I didn't know what to say. And that was a light bulb for me, because I'm thinking, why do you not know what to say? Like, we've been talking about this, like what is happening? But, you have to meet people where they are. You have to give them the tools that they need. It's easy for me to know what to say, perhaps, and not necessarily for someone else. So it's not just HR. It's not one person. It's not one team. It's all of us. And then one final point I want to add is that I came across something, and HR does not create the culture of a community. Actually, the culture, according to this information, is each individual department, each individual manager. And they gave the example of tuition reimbursement. We have an education reimbursement or tuition reimbursement. That's HR, that's the policy, if you will. But each manager, when they hear that their employee wants to take a class, you'll have one manager who says, oh, make sure you go to HR to get the benefit. And then another manager might say, oh, that's great, I'll adjust your schedule or whatnot. So the culture is created within the department or with that manager. So I think that's where our work is as HR people, is to help the managers create the culture that we want holistically for our communities.
I think too, the culture is impacted by the residents.
Yeah.
And so for our DEIB Advisory Council, it's made up of staff, leadership, board members, and residents. Because it really is a partnership. You oftentimes hear organizations like this called, we feel like it's a family, and we do here, but that family extends to the residents as well. And so how do they view our DEIB efforts? And one of the things that we first did is to talk about belonging, because the DEI context for some people is very negative, and what you see in the media can be very negative, and institutions of higher education are getting beat up over DEIB or DEI. And so the B is what we focused on. I went to the Diversity and Inclusion Symposium at William and Mary last fall and heard a tremendous speaker, Dr. Terrell Strayhorn, and we invited him, and he came and did 3 sessions for employees and staff together. And it was really insightful to see kind of the body language when he first presented and how closed off some people were. But as he made it through his presentation and really stressed the importance of belonging, you could see people relax and like light bulbs going off, like, oh, this is what DEI is.
Yeah. Yeah, I want to ask you one more question, organizational question, then I want to get back to you as individuals, if I may. Winoka, you talked about DEI is no longer a separate thing. It's now, infused in everything you do. How did you all develop the discipline to be able to make that switch, to know that it truly is infused in everything that you do at Vinson Hall?
Part of it, I would say that's a great question, is our CEO, right? Again, kind of setting the tone, if you will. And then part of it is just, it happened organically. I don't even know if I could give you the steps on how it happened. It just happened organically. We stopped, if I'd have a DEI, if we'd host a DEI event, we stopped saying it's a DEI event, and just come to the event. Just like you would come to a movie night. It's not a, Black History Month movie night. It's just a movie night. And it's just the things that we share, right? So that we are being more inclusive of everyone. So I don't know that it's really true steps. It just is, let's just put it in there. Let's put it, of course, we're all doing that in our posting of jobs and in our benefits and the information that we're sharing from a marketing perspective. But it came from the CEO, and then we got the buy-in from the resident leadership, from our leadership team, and it's the language, if you will, that we talk. Instead of branding it this way, it's just the language that we are using.
Brandy, how about for you at Williamsburg Landing? Is it a similar feeling?
Yeah, I mean, you have to look at it as a journey. There's not a point where you've got the gold star for DEIB, check,
Right.
we did that.
Yeah.
And I think it's really embedding it into your culture. One of the things that we did in January was a recognition of National Poverty in America Awareness Month. Coming out of the holidays, when you've got a lot of gratitude for, maybe tangible items that you received or time with family, that type of thing. Also recognizing that there are people that live right here in our community that don't have that and can't afford things that they need. And so we did a winter coat drive and collected over 100 coats for Grow Christian Outreach for low-income families. And another thing that we're doing in March to celebrate Women's Month is we have a guest panel of leaders in our area, president of a hospital, a board member who used to be a mayor, pharmacist, and they are going to be our current Board of Supervisors chair, and they're going to be talking about, how they feel about DEI and what has their DEI journey been for them and how do they integrate that into their work and into their leadership. So I think that Winoka hit it on the head. Like, don't make it this is a DEIB event. Just slowly make those inroads to where people, it's almost like they don't even notice, and you're training them to see things a little bit differently.
Yeah.
So what keeps you going? What keeps you, showing up in this work? How do you keep from burning out?
I do a lot of yoga.
Okay.
I also
healthy intervention.
I also took a class recently. It's through UVA has a mindfulness center, and I took a virtual class online about meditation. and the positive impacts of meditation. So for me personally, that's kind of what I do, but I'm invested in our employees. I care about their lives. I care about their families' lives, as well as our residents. You know, those relationships that you build are really strong. And so yeah, you've gotta, I think you've got to have a heart for HR. You've got to be very empathetic and understanding. And on the other side, you got to hold the line, you know. So it's a fine line that you walk in human resources, that they've got to know that you care though. They've got to know that, you know, they're being heard. I think that's most important.
Yeah, and I was gonna say mine is wine, while Brandy's is yoga.
I thought you were
But
going to say whiskey, Winoka.
well, he's the whiskey, I'm the wine.
Right. I think that's a country song, isn't it?
Is did Beyonce make it? No. Okay.
No, but she could still. There's still hope.
So I think I just by nature thrive with a lot of peas on my plate and trying to keep the peas on my plate. But after we've gone through again this look at neurodivergent people, I am more in tune with when I have too many peas on my plate, and so I can just simply step away. And I'll just use the example. I was talking to my HR generalist, and I said, I just can't hear anymore. Like I just got to stop, because there was so much information, but I was proud of myself, right, for calling it out or calling it in and sharing it with her. And we laughed and I walked away, because I really just I couldn't take any more in that particular moment on that particular day. And then I try to set the example, the model. I put on my calendar invite, which we do as a leadership team when we're out, and I put mental health day. And I put it and I shared it with my senior leaders. I don't have a doctor's appointment. It's a mental health day, and I just need the day off.
Mhm.
So that, you know, more of us do that, acknowledge that we just need the time off.
If you were to sit down, if somebody were to come to you, well, I'll just give you a real life example. So my 22-year-old bonus daughter, she graduated from JMU last year, and she's thinking about HR as a career path. What advice do you give Taylor as she is thinking about getting into your sector, getting into this field?
I would say it's tough. Sometimes, some days, some situations are tough. Some days you like people less than do on other days.
Well, she works in a restaurant, so I don't know.
Oh, okay, there we go. Some days your cup is overflowing with what you're giving and what people are giving to you. And that I believe good HR people know that this is the field for them early on.
Mm-hmm,
I think there are some of us that stay in the field for various reasons. Unfortunately, HR gets a bad rap for those kinds of HR people that just stay in the sector for other reasons. But good HR people know this is my place to be, because you are filled and you are trying to, as Brandy said, you know, care about your employees, care about their families, care about their well-being each and every day.
Yeah, I agree. You know, you really have to like people. And some days, like Winoka said, you're not going to like people. But the fact that in HR you can have a tremendous impact on a large number of employees, regardless of what department they work in, is it fills my cup. I think that everybody brings baggage to work, you know, and so keeping that in mind, that we're only seeing a snippet of who they are. So it's really important to get to know them and what fuels them and motivates them, what maybe is a trigger for them. And so building those relationships is a joy for me. It's something that I value, and I think good managers value that too, you know, not just the work that we do, but the people who are doing the work. So yeah, you've really got to, you feel it, you know. It's one of those things where you can feel like, oh, this is my calling. This is what I want to do. I want to help people. And when you have to deal with negative situations, you know, you're still helping people. You're still helping them maybe look for something that's a better opportunity for them, or is a better fit for them even within your own organization. So it's really about how can you help others.
Yeah.
So talk about just kind of have you seen changes in your career, in your decades of being in human resources, talent management? What's changed the most, do you think, when you think about your day-to-day or even just strategy overall in your approach to human resources or talent management?
Brandy, you want to go?
Sure. I think employees are more apt to be open about their needs. The conversations that I have with people are really genuine, and when they need your help, they're willing to share. And so I think that their expression of what they need is more so than what it has been in the past. I think acceptance of mental health conditions is extremely important in our workforce now, and recognizing how to engage with employees who are struggling. I think that it's become less, with the technologies and everything, it's become certainly less paper driven. So you're saving time in that aspect with all the systems that are in place with an HRIS system. But it's really the focus on people and making time in your day to focus on the people and not necessarily the work that has to be done on the back end.
And that's exactly what I was going to say. I feel like from the beginning of my career to today, it's more focused on the human part of human resources than the resources part. Absolutely being more in tune, supporting the human versus this idea of, I got to get this paper done, I got to get this process done, we have to do this by such and such date. So I would agree, it's about the people, which is why aging services, I would say, is the place for Brandy and I, right? Or at least for me, because it's about the people, whether it's the people that work here or the people who live here.
The importance of mentoring. So, and particularly, never want to leave the gentleman out of anything, but this podcast really did start with women in leadership, and I've interviewed, I interviewed my husband for one episode, and Glenn for Cal, which was fabulous.
Yeah.
So go back and listen. But, I imagine you both have had strong mentors in your life. I'm going to make that assumption. I probably shouldn't, but, I should rephrase, have you had strong mentors in your life? And if so, could you share what benefit you had from that relationship or those relationships? Kind of what advice did you get, or how did that help propel you? Or if you had bad relationships, what lessons did that teach you? Either way, I'm just curious to hear about the role of mentoring in your careers.
Brandy?
Yeah, so I have a great mentor right now who's actually one of our residents. She's the co-chair of the DEIB Advisory Council with me. And she's taught me a tremendous amount, just as far as not only aging and how that impacts your life and your outlook, but also from her professional background. She was chief of staff at the Jefferson Lab in Newport News. And so she's a very strong individual. She's also in a same-sex relationship, which is really unique for our community. They're the only folks that are out in our community. So I look up to her for that, and to be able to step out and be brave about that. She joked when they moved in, they wanted to get matching shirts that said, "We're not sisters," which I love. But she's really guided me and opened my eyes as to how to look at DEIB, and because it's affected her so personally, and it's been tremendous to work with her in that capacity. And then also on the flip side, to serve as a mentor for others is really impactful for me. I used to work with a young lady who started out as a receptionist at the school board and moved her way into comp and benefits role in a different school division, and was just promoted recently to the director of total rewards at William & Mary. So to see her career progression, to not have had a BA and to now have an MBA from William & Mary is really, I couldn't be more proud of her. And that's my jam. I love working with people and teaching them, and you gain so much from them too.
Great.
So my experience is different, and it was a recent conversation we had for people of color. Where are their mentors? And and are they mentoring others? And so I've not really had a female mentor during my career. I've had one male mentor. So where are those opportunities? And so while I didn't necessarily have them, you kind of learn along the way. I definitely have tried to mentor other people, right? Young, I'm gonna say younger people, but other people, so that specifically people of color, so that they can say, yes, I have a means of getting some experience and learning from someone who's been doing it. So my journey has been slightly different than Brandy's, but you take the information where you can get it. It may not be official mentor relationship, but you absolutely take from each positive interactions that you're having with folks, either that you worked with or reported to, or whatever the case might be. So I've not had an official mentor, but have been more of a mentor to others.
That's really interesting. I appreciate that perspective, Winoka, especially, we're on the eve of our first in-person Leaders of Color Network through Leading Age Virginia, not when this airs, but in reality while we're recording this, and thinking about the importance of the role of mentoring then, and how do we think about, do we need to be more intentional around structuring? Or providing structure or influencing structure versus just assuming, as I did when I started the question, right? Which was your face.
Right.
Your face told me to retract the assumption, by the way. So thank you for that. I appreciated that.
You're welcome.
Yeah, but I think that's really helpful, because we shouldn't assume that everybody has the same experience, first of all, right? That's part of DEIB, right? But then also understanding, where there are gaps in people's journey, because I mean, even right now, having mentoring relationships with people, as Brandy said, I learn just as much as I feel like, I mean, I hope they learn a 10th from me as I'm learning from those that I'm supposedly mentoring. Sometimes I feel like it's in the reverse, but the value of having somebody outside, like here, and be able to reframe for you. I'm mentoring a few people who are still in school and who are straddling school and work. And just, when I hear their angst, I remind them, you're still a student, be curious, like, remember you're a student, just keep sucking up the knowledge. You'll get to be a full-time employee soon enough. And that brings with it a whole nother level of things. So I'm going to ask you one last question and then see if you have anything else you want to share. But if you were to have a meeting with your young self, just on the eve of your first day of work, whatever job you want to think about, what advice would you give you looking back, knowing all that you know now?
I would say never lose your integrity. Always maintain that, regardless of how tough the situation becomes. At night, you have to lay your head on a pillow, and as long as you have integrity and you maintain that integrity and you live your ethics and morals and values, it's all going to work out.
I think I would say, again, the analogy of filling my cup, learn to fill your own cup instead of looking for others to fill the cup for you, because you're always with you. And embrace who you are. I mean, myself, my journey, emotional intelligence, my facial expressions, my body gesture, all of these things who make me who I am, which is great. I'm amazing the way I am, right? But how other people take it is not necessarily what I meant, or right. And so being okay with one saying, hey, that's not what my face was saying, or no, that's not what I meant by that tone, and just being okay with who I am and not try to fit into this idea of what I should be. One, as a female, as a person of color, also in the world of HR, there's so many different HR professionals, different, right? There's differences amongst us. So being okay with who you are, to Brandy's point, as long as you can lay your head down at night and know that you've not intentionally tried to hurt anyone or take advantage of anyone or, mislead anyone, then be okay with the flavor that you are, the sparkle that you bring.
Yeah. I appreciate your expressiveness, Winoka. It's one of the
Thanks.
things I think is awesome about you. I think we need to clarify that Whiskey is your pit bull, by the way.
Yes.
We probably needed to circle back that. We should share with everyone that we are 3 bully lovers. So Brandy, do you want to talk about yours? We'll do a round of this before we say goodbye. I think this is very critical for people to understand.
Yes.
Sure. We have had a 12-year-old English bulldog who passed in November. So we just last week got a French bulldog who's 3, and her name is Maggie, and she is just becoming a part of our family, and we couldn't be happier about it.
Does she sniff out any of Lola's things? Are there?
You know, she really doesn't. She sniffs a lot outside, and much more so than Lola did. But no, she doesn't sniff out low. Although her ashes are right there in our den, so I don't think that Maggie's found them yet.
Maggie's like, I'm not interested.
Yeah.
Winoka, you want to share about Whiskey?
So Whiskey was a rescue, and he came from Florida, and he came here with the name of Snow. That was his name, which just doesn't roll off of my tongue. He's all white. He's 5 years old. And so I'm like, that's just not the name for you. Snow. So then I'm Googling how to change your dog's name, how to change your pet's name. And so I went through that. And so, who are you? And I came up with Whiskey. Again, I drink the wine. He is the whiskey. I'm not a whiskey drinker. And so he accepted it. He took it, but he is definitely, it's just him and I. He's not into other dogs in the house. He wants to be the only one. And his temperament is like mine. Sometimes we want to cuddle, and other times we just want to stay in our own little corners. But he's been probably the greatest thing that's happened to me in the last few years, not counting grandchildren in case my children are watching.
Right.
But yeah.
Can I just ask, when you Googled how to change your dog's name, was that like from a paperwork perspective, or like introducing the name to the dog?
Introducing the name. Yes.
Like, do I go to the DMV?
Right. The tag, I get the tag. So, no, from introducing the name.
Okay, I love that. And then, as you both know, we have a Frenchie, Bella, and then we have this emotionally dysregulated English bulldog named Tank. And never the two shall meet. And it's my greatest disappointment in life. Anytime birthday candles are blown out, it's me. My wish is that Tank and Bella will get along, but you have to actually do the work for that. And that's just a full-time job. So we are bound together, the three of us, in leadership, in our commitment to DEIB and the people, and our love of these wonderful bully creatures. I can't thank you enough. I said I wouldn't keep you for an hour, and I almost have, because I've learned so much, and it's just been delightful. And I appreciate all you give to Leading Age Virginia. Thank you so much for being with me.
Thank you for the opportunity.
Absolutely.